Hello, welcome to a new series, the ICU Microdose. Here we will be reviewing basic ICU topics. Today we're going to start with patient assessment. Let's start your assessment with assessing the room. Anytime you enter a patient room, you're doing an assessment. It starts with looking at your environment, taking in the whole picture, your patient, the room, the surroundings. Bedside safety checks are a great time to be starting your assessment with the offgoing and oncoming shift. You look at the physical environment of the room to see if there are any hazards that are going to impede your care for the day. An effective workspace is going to set the tone for your shift. As you walk into a patient room that might look like this, what might you see? What things in here might your assessment tell you could impede the care that you're going to give this patient for the day? Lines going to the correct place, not hung over bed rails or on commodes, tape or other items that might be underneath your patient that could cause pressure injury. You're going to want to make sure that you're looking at these lines and where they're marked, such as like an endotracheal tube or an NG tube, to make sure that nothing has migrated during the previous shift's day. You're also going to want to be making sure, for safety purposes of yourself and your patient, that the medications that are hanging are correct, that the programmed settings are correct. You can see in this picture over to the right that there are also items on a bedside table that maybe shouldn't be there, right? Sharps, the sharps container, medications. So looking at the entire picture and the entire environment that you're going to be in for the remainder of your shift really helps make an effective workspace and sets the tone for the day. By level setting the environment, you can prevent errors and injury to both your patient and yourself, and it can assist in targeting your assessment and your problem-solving skills. So how many issues can you kind of spot in the picture over to your right? So let's start with the assessment of your environment. Anytime you enter a patient room, you're doing an assessment. All assessments start with assessing your environment. You're going to walk in and you're taking in the whole picture. You're taking in what your patient looks like, how the room is set up, how the equipment looks, and your general surroundings for safety purposes. An effective workspace is going to set the tone for your day, and level setting any potential hazards is going to help prevent errors and injury to both your patient and yourself. It can also assist in targeting your assessment and your problem-solving skills. Bedside safety checks during report is a great time to do this with the oncoming and offgoing shift, because it helps actually walk into the physical environment of the patient room. So for example, to the right, you can see a patient room that has a lot of environmental errors that you would find on initial assessment. Things such as checking your lines and drains, not only for correct placement, especially those ET tubes and NG tubes, to make sure that they haven't migrated, making sure that those lines are appropriately infusing to the correct medications, that the pumps are programmed to the correct rate or the rate that has been reported and ordered, making sure that the lines aren't draped over, for example, the side rail here or the commode, to prevent maybe that line becoming dislodged during turns or if that patient moves. Assessing for items that might be left underneath the patient, such as in this example to the right, the roll of tape, okay, making sure that there aren't lines underneath patients, medications left out, etc. So taking in the entire environment to help ensure a safe work environment for yourself and for the patient.
It's back. Looks familiar, right? It most definitely should. The bedside safety check is one of our ICU audit tools to ensure safety checks are being done during handoff with both primary nurses. Don't worry, it's only back as a reference in our micro education presentation. You can all breathe easy. The bedside safety check is one of the most essential tools to assure patient safety and create an environment to ensure the best possible outcome throughout the shift for both the patient and us as nurses. To start, AIDET. AIDET is the acronym that stands for Acknowledge, Introduce, Duration, Explanation, and Thank You. It is during this time that you can present yourself, give a good first impression, set expectations, and address any questions or concerns as a team. Also a great time to make sure that your patient's ID band matches the patient you just received or are receiving a report on, as well as a quick allergy check. There are two kinds of nurses, those that have called their patients by the wrong name and those that will call their patient by the wrong name. Next, check out your environment. Messy? Ask your fellow colleague to clean up after themselves. In a Minnesota nice way, of course. During the environment check is where you will also address your alarms. Alarms are our best friend. Let's face it, they save our money. They should always be on with appropriate limits in place and the settings applicable to the clinical scenario. Address any deviation from normal alarm settings seen on the monitoring device. Bed positioning, head of bed, side rails. Enough said. Oh, and if your patient is not intubated, make sure we have that call light within reach and not hidden underneath their pillows. Look for emergency equipment, ambu bags, suction, and anything else that you may need in a critical situation. Lastly, within your environment, check those cabinets for any lingering meds that need to be returned or disposed of. Hand off important patient belongings. The last thing you want is a family member walking in asking where their loved one's $1 million are. And really all we can do is throw our hands up in the air with that quizzical look on our face. Make sure we are performing our 6 DDDDDs of what dual really stands for. Dual checks. Do that neurologic assessment with your colleague and most definitely hand off any skin issues to bring awareness for aggressive prevention interventions. Validate that the pumps and their settings match what is given in report so there are no medication errors. Also, discuss any drips that need to be ordered or if there are some hanging out on the IV pole, in the fridge, and sometimes maybe even in the Omnicell. Verify those tube and drain placements. Is the ET tube in the same place as the documented placement? And if not, are there any concerns about it? Is that NG-OG tube at the right centimeter marking as when the initial verification x-ray was done? Or are the oral secretions tan like the tube infusing into the NG? Don't forget the other drains that should have the insertion site assessed for consistency and remaining patent without concerns. Data. Discuss critical labs and interventions as well as any pertinent hemodynamic readings. The final task in our bedside safety checks, review the plan of care for the shift. Overview the faster hug BID to assure you're getting the best possible handoff and have the opportunity to address any questions and concerns before your colleague is out the door. Oh, and I almost forgot. Update the patient care boards. Don't worry, nurses. Most often our nursing assistants have our backs on that one.
So moving on to your head to toe exam. So after assessing your environment, it's time to assess your patient. By doing your assessment before launching into your tasks, you can prioritize which interventions to do first. Okay, so for some time management. A thorough, systematic assessment provides you with a baseline of your patient for the day. And as we all know, the ICU normal is a very relative term. So taking each individual patient's situation into consideration during assessment is also important. That baseline assessment that you're doing allows you to trend small changes that can add up to a big impact. For example, an oxygenation saturation of 98% is totally normal, as is an oxygen saturation of 95%, as is an oxygenation of 92%. But if you're trending that and those numbers throughout the day, and also assessing lung sounds that might be changing, then you can put those two things together and have a more comprehensive idea of what might be happening and some interventions that might be applicable for that situation. So those small changes that are adding up throughout the day, when you look at the 98% at the beginning and a 92% at the end of your shift, like that's a bigger jump than just those incremental changes of every couple of hours an oxygen level going down by 1% or a heart rate going up by 5 beats per minute. But if you look at the cumulative throughout like a 12-hour shift, that beginning and end of the day is going to be a larger change that if you are assessing regularly and thoroughly, you're going to be able to catch before it's all of a sudden abnormal. So during your assessments, you're going to be starting from least invasive to most invasive, visually assessing, for example, before you're physically assessing. And then you're remembering that all the body systems are interrelated. Your assessment of one system can give you valuable information about another system. For example, a poor irregular cardiac rhythm can affect oxygenation, which can affect perfusion, which can affect waste excretion, for example, through the kidneys, which then can also affect neurological function, which also can affect ability to mobilize, etc. So they're all interconnected. And that head-to-toe assessment helps you gather information from that interrelatability to be able to put the puzzle pieces of your care together for your patient throughout the day.
As we look at the interminglings of the body systems and how they interact together, we get a more complete sense of the overall health of the individual. Complete assessments allow us to look at how the systems work together and how the loss or negative impact of one oftentimes has a trickle-down effect to the others. A good example of this is in a sepsis presentation, when we consider the body's inability to manage an infectious process. This leads to a drop in blood pressure and increase in coagulopathy, which leads to poor end organ perfusion, which results in shunting and generally waste excretion issues as well as electrolyte imbalances. As this progresses, it can lead to multi-organ failure and, if not treated appropriately, death. All these things are a part of a systemic response to try and manage the assault on the body. By taking the time to review all our systems, it allows you to start with a baseline with which to trend improvements and declines throughout your day. The contrast to a system assessment is a problem-focused assessment. This type of assessment has you focus your attention and time on the problems that exist with this person. For instance, if you have a patient that is in chronic heart failure with fluid overload, you're likely managing your cardiac and respiratory complications and not focusing on other areas which may not be at the forefront of your concerns. While this can be a good approach when time is limited, it also gives you a hyper-focused view and may cause you to overlook signs of decompensation until much later in the disease process. Generally, in the ICU, we should always be considering all of the variables and how all the body systems and organs are interconnected and impact each other.
The iceberg phenomenon, used to describe situations in which a vast majority of problems are either subclinical, unreported, or otherwise hidden, just waiting to be discovered. Use what you've already assessed just by walking in the room and looking at your patient. Abnormalities of appearance and status is where we begin to use critical assessment skills and timely interventions to optimize outcomes for our critically ill patients. It's as easy as our ABCs: airway, breathing, and circulation. Using the ABC framework to prioritize these elements and maintain consistency in examination, nurses can detect subtle changes and intervene proactively to prevent adverse health events. Use those senses. It's why we have them, and it helps us navigate not only our own life, but our patients as well. We healthcare workers refer to these sensual physical assessments as inspection, palpation, percussion, and auscultation. Airway assessment. Inspect for signs of airway obstruction such as stridor, use of accessory muscles, and cyanosis. Palpate for tracheal deviation and crepitus, indicating potential airway compromise. Auscultate for abnormal breath sounds like wheezing or absence of sounds altogether, indicating airway obstruction or collapse. Intervene by clearing the airway using appropriate techniques such as suctioning, positioning, or insertion of an airway adjunct, and/or prepare for an advanced airway placement. Breathing assessment. Inspect respiratory rate, depth, and pattern, noting signs of distress such as nasal flaring or intercostal retractions. Palpate for chest expansion and tenderness. Also palpate for subcutaneous emphysema. Auscultate for breath sounds across the lung fields, identifying abnormalities such as crackles, wheezes, or absent breath sounds. Intervene by administering oxygen therapy, initiate mechanical ventilation if necessary, and address underlying causes such as pulmonary edema and pneumothorax. Circulation assessment. Inspect skin, color, temperature, and capillary refill time for signs of poor perfusion. Palpate peripheral pulses, noting strength and equality. Auscultate for abnormal heart sounds such as murmurs or irregular rhythms. Intervene by initiating interventions to optimize that circulation. Those interventions include fluid resuscitation, vasoactive therapy, and even cardiopulmonary resuscitation as indicated. Critical care nursing is inherently interdisciplinary, requiring collaboration with providers and other team members to address patient needs. Upon identifying abnormalities within assessment of the patient, nurses must communicate effectively with the healthcare team to implement interventions in a timely manner, and in some cases, emergently. This collaboration ensures a comprehensive approach to patient care, minimizing the risk of adverse events and optimizing outcomes. Head-to-toe assessment. Exactly. We start at the head and progress systematically to the toes. This assessment concentrates on all aspects of the body: neurological assessment, cardiovascular assessment, respiratory assessment, GI system assessment, GU system assessment, and integumentary assessment. Be sure to check under all that hair and uncover and reposition to optimize for comfort. Also, the more you can see, the more thorough you can assess. This method ensures thoroughness and consistency in examinations, enabling early recognition of subtle changes indicative of deterioration. By adhering to this approach, critical care nurses can detect abnormalities promptly and intervene before they escalate into critical events. As exhaustive as this assessment sounds, it should be done at a minimum of every 4 hours in critically ill patients, as well as with any status change. Consistency in critical care assessments are crucial in establishing a baseline assessment, clinical status, and identifying any deviations promptly. Consistency, documentation, and communication of findings enable the healthcare team to intervene proactively, preventing deterioration and, that's right, optimizing patient outcomes. Through these strategies, nurses play a vital role in delivering high-quality care in challenging clinical environments where it truly can be a matter of life or death. While seemingly basic, nursing assessments are the foundation of which we build our critical thinking skills. These skills are what allow us to call ourselves critical care nurses. Thank you for listening to our microdose education. Please fill out the survey using the QC code provided.